About 2 years ago, we launched a consultation to develop a health and wellbeing strategy for North East England. And in the consultation that we put out, we looked at health and well-being from a variety of different angles. We looked at social and cultural aspects, we looked at lifestyle issues, we looked at healthcare issues, and we looked at what we call the life course, which is sort of following people through from birth or even before birth through till death, and in the case of families, after death. And we asked people what they thought should be a part of a health and wellbeing strategy. And one of the proposals that we made in that was that we should, as part of thinking about the life course, think about the end of life, think about death, think about bereavement and how support should be provided in those times. And what we found was that there was a strong response in the consultation that we should include as part of a health and wellbeing strategy policies and proposals really to support people in those difficult times. We know that if you ask people where they would prefer to die, 60 to 70% of them will tell you that they'd prefer to die at home, or at least not in a hospital. We know, in fact, that the majority of patients, of individuals, die in hospital. Now, clearly, when somebody's very ill towards the end of their life, they may make a different choice than the one that they would make well in advance. But we don't think it would be as big a difference as we're seeing there. And we think a lot of people end up having an experience at the end of life which is not the one that they would choose. The idea of a charter really is to state what we think are entitlements, the things that we think people should expect, the way that they should expect to be treated, and the way that their choices should be respected near the end of their life, and the way that their family's choices should be respected at the same time. So we saw it as a way of making a clear statement about what collectively across public sector organisations and across the community we were trying to achieve around the management of death and the end of life.